All to OWASA's second PFAS community chat. I'm Katie Hall. I'm the Public Information Officer for OWASA. The topic for today's chat is the science and engineering behind removing PFAS from drinking water. So first I want to thank you all for joining us this evening. I love that we've all come together in this atmosphere. It's one of my favorite atmospheres around, and we really are so thankful to Lance's Cafe for welcoming us here and disrupting their daily cafe life. Thank you. So most of you have heard, because Bree is really great at passing around information, you're welcome to order coffee or tea or water from the counter or on us. Just tell them you're here for the OWASA event. We trust everyone who's not here for the OWASA event will like that. So we're joined by three panelists today who are the experts on this topic. And first we have Jeff Thompson. He's an engineer with Black & Beach. He's their client director, and he's also our project manager for our pilot project. Allison Spinelli is our engineering manager for capital projects. And Orlando Coronel is an associate professor in UNC's Gilling School of Global Public Health in the Environmental Sciences and Engineering Department. He is also the co-project director at NCPure, which is doing a lot of research around PFAS in drinking water. We brought this group together today to start what we hope will be a very well-informed community discussion about PFAS in drinking water. And I've got some questions that I'll ask our panelists to keep the discussion moving along, but we also really want to hear from you, what's on your mind specifically as it relates to PFAS treatment technology for drinking water. And we will have more in this series, so if you've got questions kind of off topic, we hope that we'll be able to address those. If you'll fill out a survey before you leave, we will use that to guide us in future things that we discuss at these chats. So for those of you who are kind of new to the topic of PFAS, PFAS is short for poly and perfluoroalkyl substances. And they come from all kinds of chemical compounds that have been used in manufacturing for decades now. And science is finding that they stay in the environment and the human body for a long time, and that they're causing health impacts. And the science is still going on, but we know that we have some in our Cane Creek Reservoir, and OWASA is actively taking steps to get the best technology we can to remove that from our drinking water. I'm sorry if the microphone is going in and out a little bit. So each expert on our panel has a different perspective on the science, technology, and engineering behind removing PFAS from drinking water, and I'm just going to ask them to each take a moment to tell us a little bit about their work as it relates to our topic tonight.
You guys hear me? I'm Jeff Thompson with Black & Beach. Black & Beach is a global engineering company. We specialize in water treatment, conveyance, and things of that sort. We've done probably 20 or 30 PFAS projects across the country. I've done 4 in North Carolina, and then 1 for AWWA, which is the American Water Works Association. And we were selected to help OWASA with their PFAS challenges.
Good evening, everybody. Okay, I think I got it now. So, again, I'm Allison Spinelli. I'm the engineering manager for capital projects with Orange Water and Sewer Authority. My team's responsible for executing the PFAS project as well as various other projects throughout the organization. So I work very closely with Jeff and his team on a day-to-day basis about kind of prepping for our PFAS plans, working through our treatment analysis, and then checking in on the pilot. I'm serving as our project manager for the PFAS project, so happy to chat through any questions anybody might have regarding what we're doing right now and what our plans are in the future.
Hello, working? Yeah. Hello, my name is Orlando Coronel. I am a professor at UNC Chapel Hill in the Department of Environmental Sciences and Engineering. My expertise is water purification technologies. I am also the co-director of the NCPure project, which is relevant to the topic of PFAS in the NCPure project. we aim to develop novel materials for the removal of PFAS contaminants from water. We also evaluate commercial materials at different scales to find out specifically for North Carolina waters how they perform in order to provide useful data to water utilities for the design of their solutions for PFAS removal.
Okay, thank you. So OWASA has been working with Jeff's team and Orlando's team on PFAS removal technology, and given the timing of the regulatory requirements from the EPA that came out in April of this year, and our goal for addressing PFAS in our drinking water as soon as possible, we're working with Black & Veatch to identify a near-term technology that's proven effective at a large scale to reduce PFAS levels in drinking water. We also have an eye on the future and are working with researchers like Orlando to explore the future technologies that could potentially be more effective and cost-effective for PFAS treatment. So I'm going to ask Allison, since we're working with Black & Veatch to test PFAS treatment technology that'll be integrated with our existing water treatment process at Jones Ferry Road Water Treatment Plant, can you talk a little bit about how we got to the point we're at now and the other options that OWASA considered before deciding that an integrated treatment technology was the best course of action?
Sure, thanks, Katie. So OWASA's been monitoring PFAS since 2018. We had seen kind of the writing on the wall with where the regulations might be going, and we took a proactive approach to make sure that we were well informed of what PFAS was in our system and where we might need to go into the future. About 2 years ago, we did contract with a different consulting firm to start understanding what breadth of opportunities we had for treatment. So that ranged from everything from reverse osmosis to in situ technologies where we'd actually go out and remediate the soil that had been contaminated that might be leaching some of the PFAS into our water, as well as some of the technologies that we've also identified as some of the more promising technologies for use at our treatment plant, such as granular activated carbon absorption as well as ion exchange absorption. And those are just two different absorption technologies that have been shown through some of our past literature review, data analysis, as well as potentially some of the data that we've found from our laboratory testing that we've done at a smaller scale to be successful for removing the PFAS compounds from our particular water. We have started to work with Black & Veatch here in the last year or so now with developing our pilot program. So we are running a full-scale pilot within our Jones Ferry Water Treatment Plant to test those two most likely technologies, both granular activated carbon and ion exchange, to see which one of those technologies could be the most efficient and effective at removing the PFAS from our water system as the water goes through our treatment facility and as we experience any seasonal variability that we might have.
Thank you, Allison. And at this point, I'd like to ask the audience if they have any questions about what we just introduced. This is a great time to ask any introductory questions you might have. Otherwise, we'll keep moving with the conversation. Yes, sir.
So I understand the main source for the PFAS, et cetera, in our water is the sludge that's on the fields in the northern part of the county. And that came from the water treatment plants over on the Hall in Burlington or some such place.
Yes, that's correct, from Legacy Biosolids application.
Have we at least stopped having them put that on, or letting them put that on there?
Yes, it's been many, many years
It's
since
a
there's
start.
been any biosolids
Okay.
been put on there. Yes, many years,
Okay.
even since before PFAS kind of research began.
And it will eventually be leached out and not be as much of a source.
As Katie had mentioned previously, PFAS compounds are very long lasting. PFAS compounds are very long lasting, and it can take a very long time for them to degrade, if they degrade at all. So they may never actually fully degrade from that
To
area.
be leached out of whatever they're in. I mean, they can go downstream and be degraded and, I don't know, water. But I mean, is that not happening?
I will say I don't personally know about the degradation chemistry of PFAS in the long term,
Okay.
but we can get back to you on that. I can probably
Thank you.
get with Orlando about it.
Yeah, I will say that she said we've been monitoring since 2018. To this point, we haven't seen a reduction.
A diminution of that, but
Yeah.
bad.
We are moving to a karaoke microphone system, so I hope that might be the real beginning of the party. Terry, you have a question?
Yeah, there's a lot of people living out along Cane Creek that aren't on the Wassa water. Are their wells being affected by the PFAS?
That's close. We are currently working with Orange County on a couple of different initiatives out by our reservoir, and we will continue to be working with them to help get information out to the public that needs to know it out in that area.
So you're working with environmental health?
Yeah, so we contacted the Orange County Health Department, the North Carolina Department of Health and Human Services, the Department of Water Supply, as well as Water Resources. So we did all those.
Thank you. Any other questions before we move on?
Yes.
Yes, sir.
I understand you're pilot testing two systems, the granulated activated charcoal and ion exchange. Are these designed and built in place, or are you using a commercial system that's available and plugging it in?
I don't know that we've made that decision yet. You could do either. Typically, the commercial systems that you would buy and plug in are limited to smaller scale water treatment plants. I would expect that in this case, we would build something on site.
Thank you. Yes, sir.
Would it be possible that you would use a hybrid of both of those systems, or just one?
Right now, we're piloting. The gentleman mentioned two, so it's two fundamental treatment processes. But we're piloting several combinations of each of those processes to figure that out. We are expecting that it might be a combination of more than one that would be the optimal treatment for Owasso.
Yes, ma'am.
Do you know how long that pilot project is going to be?
Right now, we're anticipating maybe 18 months, and that we would have some early results after 5 months of running the pilot, but we do want to run it to exhaustion so that we can anticipate what the operational costs are going to be once the system is built and in place. So we want to keep collecting data, even though we might have some early answers about which direction we're going.
And what is the date? The end? The 18-month date?
Whatever February plus 18 months is. I haven't got that in my head yet, but we started in February.
The other reason that we do want to run the pilot so long is so that we can truly see the seasonal variability of our water as it comes through the different reservoirs at different times to make sure that we don't miss anything. You could definitely get answers, like Jeff said, in 5 months, but it's very important for us to have the whole picture so that we can make the best informed decision for how we want to treat for the long term.
That's a good segue for me to ask Jeff, when your group started working with OWASA, did you know where to start in terms of identifying what technology could really work for us? And can you tell us how proven technologies that we're testing actually function?
So there's a couple of questions in there. Yes, we did know where to start. We've done a number of these before. In fact, one of my first PFAS projects was the Wilmington Cape Fear Public Utility Authority project and for the Sweeney Water Treatment Plant. But the industry has known the treatment technologies for PFAS for some time, and they're primarily GAC, ion exchange, and membranes. So you could put those in two categories. It's either an adsorption process, right? The contaminant sticks to the media. Those are the GAC and ion exchange, or it's a separation process where you have a membrane, dirty water on one side, clean water on the other. The membrane works the best. It gets almost all of the contaminants out. It's very expensive, and then you're left with, what do you do with this dirty water? The adsorption processes work very well. They're very well known, and sometimes they have some ancillary benefits that the treatment plant might also be able to capitalize on. They're significantly cheaper. Not many people, even across the country, are doing RO because of the cost. And we have pretty robust treatment plants in general in the United States. So the RO doesn't really add any added benefit other than getting most of the PFAS out, and it comes with a great cost. While again, the GAC and ion exchange can add some ancillary benefits. Maybe you can optimize some of your other processes, save a little money there. The way they work, GAC is an adsorption technology, and it's granulated activated carbon. And the activation means that they basically baked it so that there's a lot of pore space inside the carbon. If you imagine like a golf ball, if you will, with the little dimples, right? And the contaminant likes to find those crevices and dimples, and it sticks there. But there's only a limited number of those spaces on a golf ball, and the same thing is true with the GAC. So once you fill all those spaces up, then you've got to do something with that media. In the case of GAC, you could just have it hauled off and buy new virgin media. It's very expensive. What most places do is you send it off to the media manufacturer and they regenerate it. So they cook it again, destroying the PFAS, and they send you back the same media that you sent out. That's the crux of the GAC process. For ion exchange, it's more of a ionic connection that the chemicals make with the ion resin. So the resin is positively charged, the chemicals are negatively charged, and it sticks to it, makes a pretty strong bond. The limitation there is that we don't yet have a regenerable ion exchange. So you have to send that media off, and a media company disposes of it, destroys the media in the process, and then you buy new media. I think that's the explanation of all the types.
That was very helpful. Thank you, Jeff. Does anybody have any questions about the technology that Jeff just described specifically before we get moving forward? Okay, we'll just keep it moving. So Orlando, you're involved in the cutting edge of research on technologies for removing PFAS from drinking water, and you've helped run a pilot project on novel sorbents using water from Oasis water treatment plant. What can you tell us about that project and research in general on this topic?
So let's start with the research in general. The most common technology used to remove PFAS, as Jeff mentioned, are the sorbents, right? And there are 2-3 important things that need to be improved in the sorbents. Like current sorbents work, but if you want to make it cheaper, better, there are things to improve in them. One of them is how much PFAS you can remove with the sorbents. As Jeff said, the removal capacity of the sorbents for PFAS is finite, so at some point they get full of PFAS and they stop working and you need to change them. But if you increase the capacity of the sorbents for removing the PFAS, you could use it for longer. Perhaps you could have a smaller footprint for the water treatment plant, for at least for the system for PFAS removal. So that's one thing that we are trying to do in the NCPUR project, and other researchers, in academia as well as in the industry are trying to do, improve the removal capacity of the sorbents for PFAS. The other point that is important to improve in these technologies is what is called the selectivity of the sorbent for PFAS. As you know, there's a lot of other type of things in water, right? There's salts, there's organic matter, etc., etc. And those sites where PFAS sticks to the sorbents are actually taken by those other things that are in water, right? That's why they are called competitors. So if you want to improve the performance of these sorbents, you need to make the sorbent selective for PFAS, right? So that it likes removing more the PFAS than what it removes the other things, the salts, the organic matter. That's another aspect that we are working on in the NCPUR project in terms of developing novel sorbents. We are trying to make them have higher capacity, but also higher selectivity for PFAS. Those two characteristics actually could improve the sorbents in, of course, their performance, but also the footprint of the water treatment plants, because we are using more of the sorbent to remove more of the PFAS. Another aspect that we are working on, and that will be very important potentially, is the ability to reuse the sorbent. As Jeff mentioned, once these sorbents are used up, the capacity is used up, then you need to basically take them off-site. For the carbon, you basically burn it again to reactivate it. And for the resins, you need to dispose of them or burn them up also. So what we are working on in NCPUR is to make the sorbents reusable, and the way to make them reusable is what is called regeneration in general in the water treatment field, which would be to be able to wash off the PFAS from the sorbent so that you can reuse that same sorbent again. And of course, that could have important implications in terms of the cost of the technology, the cost of ownership for the water treatment plant, and of course for the citizens that are paying for that treated water. That comes with reusability, regeneration of the sorbent comes with its own set of practical things that you need to deal with, like what do you do with that concentrated PFAS solution once you regenerate the sorbent. But the last important thing, right, that is being done in research is destruction of PFAS, right, which we have not talked about. We are obviously trying to remove the PFAS from water so that people drink water without PFAS, but in removing it, the PFAS is still there, right? And the current solution for that is to dispose of it in landfills or, maybe take it to incinerators, right? Like hazardous waste incinerators. But ultimately, right, what scientists, the industry, the water treatment plants, and everyone wants is to be able to destroy the PFAS. And that's its own field of research. There's many people working on that, fortunately. There's various companies that are trying to commercialize systems for PFAS destruction. So if we were to develop a reusable sorbent, that concentrated PFAS solution that would come out of the regeneration of the sorbent would go to a destruction technology. So the PFAS is destroyed and the cycle ends there, right? As opposed to putting it back maybe in a landfill, which eventually some of it goes back to the environment. I think those are the main points in research right now.
Thank you so much. Does anybody have any questions about research on PFAS removal technologies? Yes, dear.
I have a question about the pilot that you're running. So, water comes in at the treatment plant and it's got PFAS in it. You clean it up, then we all drink it and put it back out into the wastewater system. And then it's got at the wastewater treatment plant and going into Morgan Creek. So which of are in your pilot testing, are you looking at which solutions are going to work best with the removal at the wastewater plant also? Or are these two completely separate issues?
Yeah, they would be separate. We're only looking at the drinking water side. I don't know if Allison wants to.
We do have another study that's ongoing at the same time as the work that we're currently doing at the water treatment plant with the pilot with Jeff's team. We're working on another study with a different consultant to understand where PFAS is coming from throughout our entire system to the wastewater treatment plant, and working on characterizing that and understanding those sources, as well as we just recently completed a master plan so that as we start to understand more about what potential PFAS regulations might look like in the wastewater side, we have a roadmap that details kind of what our plan will look like moving forward as those regulations start to come into light, and we have a little bit clearer understanding of what expectations will be on the wastewater effluent side of things. But I will say, we were just talking earlier today that as we bring on a new PFAS treatment at the water plant, we'll definitely be watching very closely to see how that impacts our wastewater stream, because we'll be moving so much from the water that you wash your hands with and the water that you take a shower with, and all that ends up at our wastewater plant. So seeing the relationship between those two pieces is going to be really impactful over the next couple of years, so we can truly understand what the wastewater treatment plant might need in the future.
Thanks, Allison. Any other? Yes, sir.
You bring out the wastewater treatment plant, monitoring the effluent there, to try to do a mass balance of what's going in versus what's going out.
As part of our PFAS project at the wastewater treatment plant, we are doing some characterization and some mass balance work. We don't fully have all those details to share yet because that work's just underway, but we will be able to share that probably on our PFAS dashboard at some point in the near future.
Thanks. Any other questions about the? Yes, sir.
So, sort of related to the fate of PFAS entering the wastewater treatment plant, you mentioned that long ago you stopped land applying the biosolids. What's happening with the biosolids currently?
Oh, so biosolids that were applied that have affected
Sorry.
Cane Creek?
No, sorry, the biosolids currently being produced at the wastewater treatment plants, where are those ending up at this point?
Those are land applied. Does Monica's got experience in it? Monica, do you want to answer?
Yeah, those are land applied in areas in mostly Alamance County, some in Chatham County.
Okay.
Yeah.
Any other questions about the technology or the pilot project? Yes, sir.
What else does GAC take out other than the PFAS of good and bad?
I don't know if there's anything bad, but I'm not going to be an expert in what it takes out of my bad. I've not heard anything bad that it takes out, or good that it takes out. There's several things that it takes out. TOC, any organic material that is in the water, GAC would take out. It's like a filter after your filter, basically.
So part of my story is that I did my undergraduate research on GAC, so this project comes full circle for me. And spent some time with one of Orlando's colleagues at NC State, with Knappy, working on GAC research in my master's. And one of the other things that will come out with GAC are pharmaceuticals, personal care products, other things that have been in the news about different things, estrogen type compounds. A lot of those items are also able to be taken out by GAC, but one of the things that I will caveat with is that a lot of that's dependent on you target different things with the GAC and the amount of time that you let the water pass through that particular absorption treatment. So we are going to be preferentially trying to remove PFAS compounds with the absorption technologies that we're working with, but we hopefully will get some ancillary benefits as well.
Thank you, Allison. Any other questions about technology before we move into, yes?
What about fluoride? We put the fluoride in the drinking water, it's gonna pull it right back out.
The fluoride is added after this treatment would be in service in the full-scale facility.
So Allison, now that OWASA's gotten our pilot project off the ground to test granular activated carbon and ion exchange technologies, which Jeff explained, could you talk a little bit about what we're learning in our pilot project, how that will help us make decisions about PFAS treatment technologies?
Sure, so like others have mentioned, we're looking at multiple treatment combinations of both granular activated carbon and ion exchange. So we're looking to see which one of these treatment combinations provides the best removal of the PFAS compounds for us while still meeting the other water quality goals that we have. So we still want to produce a high quality water that meets all regulations, that smells and tastes good, all these different things. So we'll be comparing all of that different research. And as we've mentioned previously, we have started to gather some results. The pilots have been in operation for several months now, and we still have a few more months to go until we can start making any early out decisions. But there are a lot of different things that we're starting to see. All of the different medias are working very well, kind of as expected right now, and I think in the next couple months we'll start to see the ability for us to discern which media might be working better than others. Some of the other things that we think that will come out of the PFAS project are the ability to forecast some of our operational costs that we'll look at into the future. So as we're starting to evaluate which treatment technologies are going to provide the most benefit to our customers who are drinking the water and complying with the regulations and meeting all of our water quality goals, we'll also be able to see how much media changeouts are we going to need in order to meet those goals? What is that going to cost? What's that going to look like into the future? And it will help us understand some of the more operational impacts that we might have once we've selected the best treatment.
Thank you. And Jeff, OWASA is not the only utility that you guys are working with. Can you tell us what you're seeing work and not work in your projects with other utilities?
Sure. Most utilities are going the route of GAC or ion exchange and on their source water. There are some utilities that have put in an RO system. Getting a permit to discharge that PFAS laden water is difficult and lengthy, and it's sort of I want to say it's an ethical issue that they sort of grapple with, but you are putting it right back into the environment. So most utilities are doing GAC or ion exchange. We're working for, probably 4 in North Carolina. We're working for 2 in South Carolina, working in Miami, Colorado, we're all over the country, and most of them are doing sort of that known technology. Everybody is looking at what the next iteration of technology is going to be, the stuff like Orlando is working on, and everybody is waiting for a destruct technology. We're years away from that, and we have to have a solution today. So that's what most people are doing.
Thank you. Does anybody have a question before we move on? Yes, ma'am.
Are other counties in this region, are you working in tandem with them, or are you working in isolation, like Chatham or Durham or other nearby counties?
Most of our work is, I don't like to use the word isolation, but most utilities are making their own decisions. The cost impacts are directed towards them. But as engineers in the industry, we know what everybody else is doing. So I would say every utility in the state is making a decision right now on how they're going to deal with the new regulation for PFAS. Raleigh is doing something, Durham is doing something, Chatham County's doing something. Winston-Salem's doing something, Charlotte, all of your neighbors are doing something related to PFAS. There's not a whole lot of in tandem, if you will, but there is a lot of collaboration with the Triangle Water Partnership that they meet every month and talk about what everybody is doing. So that's a great organization that the utilities have just come up with themselves. So they're talking, they're just not necessarily working in tandem as far as I know.
Yeah, OWASA specifically has done a lot of site visits to other utilities that have already put in some sort of PFAS treatment. So we've been down to Pittsboro to see their granular activated carbon. Our water treatment plant staff has been to Cape Fear out in Wilmington to see what their facility looks like, and we'll continue doing that. And like Jeff mentioned, we are in pretty constant communication with our neighboring utilities. And granted, we all have different source water and some different challenges, so our ways that we're addressing those different challenges might be slightly different, but we're definitely always talking, and there's definitely a good stream of communication between all the utilities.
Thanks. And Allison, can you just comment on the biggest challenges that OWASA is seeing in water treatment for PFAS in terms of what it will take for us to put that technology in place?
The PFAS project is one of our biggest projects that we've had in a really long time. So the cost is one of our major challenges. Space on our Jones Ferry Road campus is becoming very challenging. We are building another Clearwell at the same time that we're also doing our PFAS project. So right now we're embarking in a study on how we're going to be able to park staff at the facility kind of moving forward, because we know we're using up a lot of space. Other things that we're looking at are kind of understanding how are we going to dispose of the material. Like Orlando was mentioning, there's a lot of use it once, regenerate it, but then you might get it's like a spent PFAS solution in certain situations, or you end up with some sort of PFAS laden end product, and we have to be very mindful about where and how we're disposing of our end products that are being used up with PFAS. We also have major construction impacts, and we need to make sure that we keep the water treatment plant in service, delivering high quality water that meets all the regulations throughout the entirety of construction. That's really going to be goal number one during construction, is making sure that we maintain the plant operations and that we can provide reliable, high quality service to the community. Other than that, rising costs of all of the absorption technologies, like several of you have noted, we're not the only utility facing this, so we're very concerned about what is granular activated carbon or ion exchange media going to cost in the future? How do we forecast that? How do we get a handle on supply chain? Those different things are all on the horizon and are all things that we're tracking. We've got a really robust risk register that we're working on to try and make sure that we're tracking any risks that could potentially present a problem to us maintaining compliance, meeting future compliance, and being able to deliver the water that we want to the community.
Thank you, Allison. Any questions for Allison about the technology or our future facility? Kim?
I've got a general question. I'm just curious how often the GAC filters can be effectively regenerated and reused, and if we know anything about how the effectiveness is compromised as the life cycle continues and the filters are continued down the line.
Let me think about that question a minute. So there is no limitation on how often it can be done other than your tolerance for pain at the water plant and your tolerance to be able to pay for it. So, our job as engineers, there's a quote, I think it's Arthur Wellington, some railroad engineer. He said that engineers do with $1 what any fool could do with $2. So our job is to really find the optimal solution that can stretch out how long we can go with that media and not have to do it too often. We don't have an answer yet on what that is, and we don't even have a goal yet because we're still early in the process. I can tell you Cape Fear is changing out their media every 9 months, which is a pretty constant evolution of trucks coming in and out. So we don't know yet what we're going to end up with, but there's no limitation of, again, and how burdened do you want to be at the plant with trucks constantly coming and going and how much you want to pay for.
Thank you. Terry?
So when we get water from other utilities in the event of an emergency, and they have a different treatment technology, does everything work together? Like if we get Durham water and they're doing ionization and we're doing carbon, is it easily exchangeable and no difference?
In the context of PFAS treatment, the answer is yes. There are some other things that would need to be considered, and I'm sure that the utilities have considered those. But in the context of PFAS treatment, yes. Once it's out, it's not adding anything to the water. It's just removing the PFAS.
Does that answer your question? Orlando, from a research perspective, what are you seeing that might define the future of removing PFAS from drinking water? Can we expect opportunities for lower costs? Any hope for a smaller footprint for our treatment facilities? And any improvements of disposing of spent materials?
I sort of, answered that the previous time I talked, but generally, yeah, if the research continues the way it's going for the sorbents, which is to increase their capacity to remove PFAS, so removing more PFAS per kilogram of sorbents that you are using. If you increase the selectivity of the sorbent for PFAS, which means that you are not wasting PFAS capacity in removing other things, then you should expect be able to have a lower footprint for the removal systems. In terms of the costs, I'm not an expert cost estimator. There are many things that go into cost estimation. But in principle, if you improve PFAS capacity and selectivity without using too much of a fancy material, then in itself would cost too much, then you would also expect some improvements in cost. If you have sorbents that are reusable, right? I guess that one is self-explanatory. If you can reuse something, then it's cheaper because you buy it only once, right? As opposed to buy a new one every single time you need it. I should add there potentially, right? It all depends on what is this magic new material that you are able to reuse. And from the research point of view, right, we are doing it at NCPR. I'm sure others are trying to do it. You are trying to achieve these improved properties of these materials at a cost-competitive point, right? Without using fancy materials, without using fancy manufacturing technologies, so that from the get-go you are competitive in cost. So I think it will be achieved. We have promising results in the work that we are doing. I hope that others, in other laboratories are also having them. So in the future, yeah, but as Jeff said, these things are probably years away, right? And utilities like OWASA need to take a decision now on how they are going to solve the problem right now. Yeah, that's it.
Thanks. Does anybody have questions for Orlando about the future of... I turned it off. Does anybody have a question for Orlando about the future of research on PFAS technologies? No research questions. Okay. Oh, yes.
Actually, yeah, as you evaluate the increased sorptive capacity and potential for regeneration of these new media, are you also looking at their capacity for other PFAS compounds currently not being regulated? ultra short chains, precursors?
Yes, thank you for the question. Actually, yes, I can tell you from the work that we do at Insipure. In terms of what PFAS we look at, we are focusing on a broad range of PFAS, all the regulated ones plus several more. And the way we do this is that we work with different water utilities across North Carolina. OWASA is one of the ones that we work more closely with, but we work also with other utilities across North Carolina. And the way we chose these utilities is looking at different types of water, right? So OWASA has surface water from around here, right, like Cane Creek, etc. But we also work with surface water from other parts of the state, like the Cape Fear River. We work with groundwaters, and we look at what PFAS are in those waters. So OWASA has certain PFAS in their water, the other utilities have different PFAS, and that's how we are trying to develop these materials, so that the materials are ultimately effective for a broad range of PFAS, a broad range of waters, but at least we know how to manufacture materials that are effective for these different type of waters and these different type of PFAS. So yes, that is being taken into account, because the current regulations are the current regulations, but we also don't know what, what is going to come in 5 years or so.
Yeah.
Thank you.
I have a related question.
Yes.
He was asking about the other kinds of PFAS. I know that there's a limited number that you can test for, but there are 15 to 20,000 different PFASs. In addition to testing for the ones you're currently looking at, are you doing anything to measure total PFAS that includes the rest? Not as individual species, but as a combined.
So Jeff might have to help me out here a little bit, but we are doing 2 different methods in our PFAS analysis. So there's an approved method that looks at the regulated PFAS, and then there's, I guess there's one primary regulated or approved method for regulated PFAS, and then there's another approved method that details many myriad more PFAS. There's also, and we're testing for both of those. And then there's also UCMR 5 testing, which is done throughout the entire country, which is testing for some additional PFAS in a variety of different surface water and water treatment plants in different locations all across the country. And that's going to provide some more detail about the level of likelihood of those particular compounds to be observed in water treatment systems and finished water. And we're going to continue to watch that science, but as method detection levels continue to change and as treatment technologies continue to change, the science is going to be keeping up with it, I'm sure.
Thank you. And then a question for Jeff and or Allison. Given what you see as challenges in PFAS treatment, what would you like to see, and what are people you work with like to see for future research on treatment technologies? What are you hoping that research might contribute in a perfect world?
I tend to be more of a realist in what do I see that's really going to happen, and it's really the stuff that Orlando is doing. Like the technologies that we're working on right now, I don't think are sustainable is not the right word, but it's very expensive. Every utility in the state is going to spend a lot of money to get this contaminant out of the water. So anything that we could do to get those costs down, it's mostly the operational costs. Like the capital cost is going to have a big sticker, but the operational cost is going to go on every single year in perpetuity. So if anything we can do to, one, get more capacity out of the media, and two, can we regenerate it on site? Can we make it cheaper to regenerate? The GAC, for example, that gets trucked up to Pennsylvania and New Jersey to be regenerated. So even if we don't change anything, maybe we'll see sort of a regional regeneration facility, down in the rural parts of the state where it's a little more, land is cheaper. Trucking it it's painful. So that's the kind of stuff that I think about and I'm optimistic about. Again, the destruction would be the ideal world, but I think it takes 2 megawatts of energy to destroy 1 million gallons of water that's got PFAS in it. So that's 60 megawatts that you guys would need to destroy PFAS from your drinking water plant. So it's just, we're not there yet. We're maybe decades away from that.
Yeah, I echo a lot of what Jeff is saying. I think the regeneration and the overall operational costs are pretty concerning for the long-term view of PFAS treatment. Something else that I've thought about too is more chlorine-resistant absorption media. Right now, we're testing one novel absorption treatment that allows it to have chlorine added on top of it, which complies with kind of where we want to put it into our normal treatment process. So if there were more medias that allowed that, that would be really helpful too. But I echo everything else that Jeff is saying, and we appreciate Orlando and what he's doing right now with his team, because a lot of their research is going to inform the future of PFAS treatment, and it's going to be helpful for utilities down in the future.
Yes, ma'am.
So I had a question for you, Jeff. So we have to send the media up to, what, you said Pennsylvania to get it treated and get the PFAS removed? So I guess as I understand, Oasa's kind of on the forefront of this, but as other communities nationwide catch up, do you expect that there would be, you know, like a backup at those facilities where we couldn't even send it off?
So I don't want to commit to Pennsylvania. There is a facility in Pennsylvania,
Yeah.
but there's not one close. I think the opposite is going to happen. I think the market is going to respond to a demand in regeneration of media, and they're going to build more or closer regeneration facilities. That's what I think is going to happen.
I actually had a conversation with one of the media suppliers a few months ago. Calgon is one of the larger manufacturers. They also make things like Brita pilchers and things like that. And they said they were getting ready to start building a new regeneration facility in South Carolina.
Okay.
Yes, Terry.
So I appreciate you saying that the long term is not very sustainable. So if you feel that way, and this is a question for both of you, if you feel that way, why isn't the research focusing on removing it from the land itself?
It's even less sustainable. It's very expensive. I mean, the first, whenever you're trying to remove something, the first step is to concentrate it, and so it's concentrated in the water, unfortunately. And for the utilities purposes, that's the most cost-effective way to deal with it. Trying to get it out of the land, you might spend $1 billion trying to do that, but
why not treat it at the stream level where it's coming into the reservoir?
I think you've looked at that, but that would be building a whole new treatment plant, and you would still be paying the same operational costs to regenerate whatever media you're doing there. So I think your capital expense would go up, and your operational expense might not come down any.
In a nod towards sustainability, we are planning on designing the facility, whatever the pilot kind of leads us down the path to be very future-proof, so that as novel sorbents become more market-ready and more commercially available, we'll be able to have access to those in whatever sort of absorption, contactors, pressure vessels, whatever we choose to do. Those things will be able to be hopefully swapped in and give us a nod towards sustainability, so that we can take advantage of all the research that's going on in the future.
Yes, ma'am.
I think I had a similar question. Have you guys considered trying to put the onus more on industrial users who might be, contributing to the PFAS problem, rather than taking the whole burden yourselves?
We are currently part of a multi-party litigation against some of the manufacturers of PFAS, which will hopefully lead to some sort of monetary disbursement to us at some point. We don't know how much or when that might be coming, but we have entered into that multi-party litigation at the advice of our counsel.
Yes, ma'am.
Not a scientist, so when you use the word solvent, I think of dry cleaners and gross contamination. So do the solvents themselves come with their own risks and harms, medically and environmental?
I'm also not a scientist, so I'm not sure I understand the question though. Solvent in. Sorbent is the thing that the contaminant is sticking to. It's not solvent. Yeah.
Okay,
Yeah.
and is that material safe?
Yes,
Thank you.
it's been used for other treatment purposes for decades. We use it quite extensively for treating other contaminants.
Thank you.
What time you got? I don't want to hold the floor. Okay. We've got time for maybe 2 more questions for our panel. Anybody have? Yes, ma'am, in the green shirt.
I was curious about the timeline that you were talking about here. You say it should all be in operation by 2029. Is that still the timeline you're thinking, or shorter, longer?
That is still the timeline we're thinking right now. So, like we've mentioned previously, we're in pilot studies right now. As soon as we've got some decisions out of the pilot, we'll start getting kind of hot and heavy in design and moving that forward as fast as we can. But we're looking at probably at least 2 years of construction. So even if we move at the speed of light for design, we're probably going to be 2029 before we're operational. And that will be ahead of compliance deadline for regulatory compliance.
Allison, you might talk about what we're doing now.
Yeah, so we are taking this issue head on and making sure that we're providing the safest water available to our customers. So as soon as the MCL came out that we were going to be above the regulated compound concentrations, we have been doing various powdered activated carbon additions to our treatment plant. So we have been adding powdered activated carbon for years. This has been a long-standing way for us to help handle some taste and odor that's just kind of natural when you have surface water. Different surface waters have different algae and things that can cause odors and taste. So we've been adding powdered activated carbon for years at our water treatment plant. But in response to the changing PFAS regulations, we've gone through several different trials to try and find powdered activated carbon that is also really effective at removing PFAS. And so our water treatment plant has done an amazing job of optimizing our PFAS, using our existing optimizing our PAC treatment for PFAS removal, and optimizing what we currently have available at our treatment plant to make sure that we're staying as low as possible on those PFAS concentrations.
Let's see the gentleman in the green hat.
Yes, thank you. You had mentioned WASA working with the health departments regarding well water and things like that. Has WASA been had in conversation or working with the planning and inspections department at all in ways of effectively using land use policy to mitigate the introduction of these chemicals into our environment? Because it seems like you're addressing symptoms to a certain extent without addressing the actual source.
To my knowledge, we have not yet engaged with the planning departments or inspection departments in either Carrboro or Chapel Hill, but we can look into possibly doing that in the future. But right now, OWASA doesn't have a ton of industrial users within our service area that could be adding into our existing watershed. But we are looking at that as part of our wastewater side of things. Where could some of these sources be coming from? Doing an analysis throughout our collection system for our sewer system to make sure that we understand what, if any, liabilities of different sources we might have. But we can take that, as a future thought of how we might want to move forward.
So in a sense, you're still researching where they're actually coming from. They're not pinpointed. These aren't point sources. These are like background sources.
Correct,
So
yeah.
it seems to be sort of endemic to
There shouldn't be any new sources of PFAS coming into this service area. There wouldn't be any industrial users that would be allowed to discharge into our sewer system or it impacting our watershed at this time, to my knowledge.
Yes, sir, in the glasses.
How are you planning on financing the capital expenditure for the treatment expansion?
So we have several different mechanisms that we're going through to finance the capital expenditure. We are looking through various funding sources. Recently, we were just awarded $500,000 of grant money that's going to go towards the pilot and the design, and we are going to continue looking towards that. Right now, our plan is to look towards bonds as well as the incoming rates that we receive from our customers. But I will pass this over to Stephen Winters, who can provide any other information that I may have missed.
Yeah, like Allison said, we're turning over every rock, federal money, state money.
not enough to go around, so we're, we know we can issue bonds and there's low interest loans from the state that we can get. We got to pay that back. So we're looking for debt relief grants and that sort of thing. I wouldn't say we're optimistic, but we're trying.
Thank you, Stephen and Allison. And I'll take one more question to make sure everybody gets home on time. Yes, ma'am, in the pink shirt.
So what's their estimated cost in the long run to get this operation started, not the operation cost?
The capital expenditure based on our 2023 study was somewhere between 60 and 70 million in 2023 dollars. So as we are forecasting that forward, and we're still working with Black and Beach to further design and really understand what exactly was going to have to be constructed, and we will have to also factor in our engineering costs, our construction phase services, anything like that. We could be looking at something that's upwards of 70 million, but the best thing that we have to go off is the 60 to 70 million dollar range that we received in our study from last year.
Okay, I know we could all talk all night, especially with coffee, but we want to get everybody home safely. I want to thank everybody for all your participation this evening, for being here. Please fill out the survey that Bree will help you with. Bree, where are you? There's Bree. Bree has pens. Your surveys will help us figure out the best format and topics you're interested in for the future chats that we'll have. We'll have a couple more this fall at least. And also, if you haven't already, sign our sign-in sheet. If you give us your email address, we will send you our quarterly PFAS newsletter, but we won't send you anything else. If you don't give us our email address, we won't be mad at you. And thank you all, and we hope to see you again this fall. If you haven't visited our website, we do have a hub for PFAS information at owassa.org/PFAS and your water with dashes in between the words. So please also take that. And let's all thank our panelists and also Lance's Cafe for their time. Thank you so much.